Hello, I'm Natalie Chandler.
And I'm Joe Larkins. Welcome to this edition of Your Family Pet.
On tonight's show, we visit Trinity Farm to explore their therapeutic horseback riding program, and we'll find out how to deal with pet allergies.
You'll get expert advice on recognizing signs of illness in your pet, and we'll learn about one of the most popular reptile pets, the skink.
All this and more on this edition of Your Family Pet.
Production funding for Your Family Pet is made possible in part by Memphis Veterinary Specialists, a referral-based specialty hospital serving the needs of small animals, offering diagnostic tools and treatment options not typically found outside veterinary teaching hospitals, including orthopedic and neurologic surgery, oncology, dermatology, dentistry, ophthalmology, internal medicine, and more. And by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
Using a horse as a therapeutic tool has been done for centuries, but the practice of therapeutic horseback riding began in the 1950s. It's recognized as beneficial for a wide range of illnesses and conditions, such as autism, Down syndrome, cerebral palsy, and more. To find out about this unique human and horse interaction, I went to Trinity Farm to talk with therapeutic riding instructor Jenna McNair. Jenna, tell me a little bit about therapeutic horseback riding and what that entails.
So therapeutic horseback riding is horseback riding for people with special needs and disabilities. And it's in some ways horseback riding just like it would be for anybody else. We just are more aware of certain precautions and that we may have to take for riding. But basically working with kids and adults with disabilities and teaching them riding skills.
And the disabilities kind of range. What does this cover?
We have clients with cerebral palsy, we have clients with Down syndrome, we have clients with autism. I've worked with people who are paraplegics or quadriplegics. I've worked with amputees before, so really a wide range of pretty much anything you can imagine as long as we get doctor's clearance for it.
And so we kind of spent the morning out here, and I've seen some of the riders. Explain the therapy. I've talked to people, and it's been physical changes, some social changes. So what is the range of things that can take place?
Horseback riding by its nature involves a lot of different skills. So even though I'm not a physical therapist, I'm not an occupational therapist, so I'm not trying to achieve a clinical outcome as far as physical stuff, but in the process of teaching people how to ride, we do see a lot of benefits. So for instance, when we learn how to tack up the horse, they get to do the buckles on the saddle. So we get a lot of fine and gross motor skills. We do things like sequencing, so learning how to do things in an order. When you're riding, it takes a lot of core strength and balance. So for somebody who maybe has difficulty walking, when you're on the horse, you're having to balance in a way that you don't get to balance normally. And then just in general, the socialization aspect of it. Horses are fun. They don't judge people based on what they look like.
Yeah, so we've met some people out here today, and the stories range of how this therapeutic horseback riding has helped them. And one in particular, we saw Liam. You want to tell us a little bit about him?
Yeah, so Liam has been riding since he was very young. And he was one of those who didn't really walk very much before he started riding. He started off doing hippotherapy, which is actually riding that's directed by a physical therapist, occupational therapist, or a speech-language pathologist, and you are looking to achieve a clinical outcome. You're basically using the horse as a therapeutic tool. So that really helped strengthen him when he was little, and then continued to ride as he got older. And he comes every week and has come every week unless he's sick for over 5 years now. And he really enjoys it most of the time.
And I saw some of the things you were doing out there. For example, with Kennedy, you were doing sit-ups with the horse. Tell us a little bit about that and some other things you might do.
And so Kennedy, her muscles get really tight during the week. And so she gets on the horse and really uses the horse to stretch out her muscles. So one of her goals is to try and get her legs to relax and drop enough that she can ride with her legs hanging straight down underneath her. So we're working on that. And she does a lot of the sit-ups and stuff on the horse because the way the horse puts you with your legs hanging down, it's actually a lot harder to do a sit-up on a horse than it is on the flat ground. So she really gets a chance to work her core muscles and strengthen them, and it also helps her legs stretch out.
Cool.
So that strengthens her for the more things she does like that, the stronger she is and able to sit up and do things like steering and walking Micah over poles and stuff.
And how long does it take for you to train a horse like that, or what do you do to kind of train a horse to be a therapeutic riding horse?
It really depends on the horse, but we do a lot of desensitization, so we get them used to loud noises, any of the tools we may use, any of the props. So if we use a hula hoop or bean bags, some of our riders will practice throwing things, so we get the horse without the rider on them. We'll get them used to having things thrown around them so they don't spook at them. And then we have a lot of adaptive devices. So we have riders who use walkers or wheelchairs or canes or crutches, and we'll get the horse used to having those around them.
And what would you say to someone who is considering utilizing therapeutic horseback riding to convince them to give it a shot?
I would say it's really fun. You know, everyone, regardless of whether or not you're doing therapy, a lot of people are drawn to horses because there's that bond that exists between human and horse. And it's just really fun. And there's something about sitting on the horse and working with them and that bond that comes. And when you do something really well and know that the horse is wanting to work with you in partnership, it's just a really cool feeling.
And talk about the social aspect of the therapeutic horseback riding and kind of that sense of community that the people get when they come.
So it's a very inclusive environment. You know, our summer camps, we have typical kids and we have neurotypical kids, and then we have kids with autism. You know, we may have a rider who uses a wheelchair, and so we really try to integrate our program so it's not just you're coming and just doing a therapeutic program, or you're coming and just riding your horse. And I have a lot of kids who've come up and told me that, oh, I've started volunteering at this other place, or I'm really comfortable around people who are different than me now because I came here and I saw that they weren't really that different from me. So we've really found that our entire barn really embraces everybody.
Well, thank you for having us out here at Trinity Farm
welcome.
and telling us about the horseback riding. I really love spending time here, and thanks for all that information.
You're welcome. We're glad to have you.
It's not always easy to tell when Fido or Fluffy are a bit under the weather. Unfortunately, they can't tell us what's wrong, so it's up to us to know the signs of illness in our pets. Recently, I spoke with Dr. Stephen Ambrose about the ways pet owners can recognize when our furry friends aren't feeling well. When it comes to the health of your pet, let's start with dogs. First thing, cold, wet nose, got to be good. Hot, warm nose, it's bad.
Not so much. That you really can't tell with that. That's kind of a myth. So many times owners will ask that, you know, well, the nose is dry, it must be feeling bad, it's wet, they're feeling bad. No.
I mean, can that be a general barometer, or is it not even close?
Usually not, because, you know, they'll feel good and have a dry nose and feel good and have a wet nose because their tear ducts drain through their nose. And so if they just have a little more tear production, you know, they'll be wet. But if they're a little drier, then they might be dry. So it's not a good indicator.
Well, when it comes to whether it's dogs or cats or whatever pet, the main thing is if you notice a change in behavior. Is that probably one of the keys?
Yes, that is probably the #1 key. Maybe they're drinking more water than they used to, and it's not really hot outside. They're drinking more and urinating more. Those are big keys. They're not as interactive with the family. They're just more listless and lethargic. Behavior changes are one of the key things as veterinarians we rely on, that if you pick up, the earlier you pick up on that, then we can diagnose things a lot sooner.
Let's talk about cats. I will admit that when it comes to cats, I am not familiar with their particular symptoms, but are there warning signs of poor health going to be that much different from, say, a dog's?
A little bit, yes. Cats we see, for example, hyperthyroidism. Dogs typically get hypo or low thyroid. And so you'll have these cats that are just eating really good, but they're losing weight. And the owners notice that, but they're eating good. And sometimes they don't pick up on that and bring them in. And so I check their thyroid, and their thyroid is 10. And so we can treat that. And so those are some of the things. They're just really ravenous. Cats don't really come up and look at you and want food all the time. They'll also drink more water too. So if they're drinking more water and you're seeing them at the water bowl and they're wanting more water, then that can be an indication of diabetes. It can be an indication of kidney disease, and that's something to follow up on.
And also just a general change in behavior. If your pet is generally outgoing and suddenly becomes reclusive, or vice versa.
Yes.
That's
a big key. For example, you come home and they always greet you at the door, but now they're not. Or you're in the house and they usually follow you from room to room, but now they don't. And so you go and call them to you and they come to you, but they're not as interactive with you. That's a big key, because a lot of times, especially with cats, if they're running a fever, they don't want to move around much. They're kind of quiet. They want to sleep. They want to rest. You'll also see our cats and dogs have third eyelids. They're right here. It'll actually kind of come up like this, and so you'll see that, and it'll actually look like the eyes may be rolled in the back of the head, but it's not. That third eyelid is up, and that's usually they feel bad.
Some of the dogs that we have rescued over the years will eat just about anything. So if they're outside, is there a danger that they might eat a plant or something that could cause illnesses
there are,
as well?
especially, with Easter and stuff like that, we do see some of the lilies. They can cause a lot of GI stuff. They can cause kidney issues. And so if your pet is eating a plant, especially some of the decorative plants, you need to call your vet and ask about that. A lot of them cause GI, vomiting and stuff like that, but some of them are very toxic.
Is that primarily an issue with dogs, or will cats get involved?
It's mainly with dogs, but most of the time we see it with cats when owners bring plants in that are blooming, some of the lilies and things like that. The lilies are pretty toxic.
So, but circling back around, the big thing about dogs or cats or whatever, a change in behavior, is that would be the number one thing?
The number one key as far as change in behavior. They are not eating as well as they were. They're more reclusive. They're not as interactive. They may or may not vomit. And so that's key, is their behavior and interaction is key to watch that something's going on. And that's one of the earliest detectors that we can see that they need to be seen.
Few people can say they know more about their pets than the actual owners. So, as an owner, when you notice something, that's when you observe and then head to the vet.
Absolutely, because that's their environment. They're at home. They're acting normal. And if they're not acting normal, then something's wrong.
Dr. Ambrose, I hope we haven't made anybody paranoid out here, but it's better to err on the side of caution.
Yes, sir. Thank you so much for having me here.
And thank you for joining us again. Our breed of the month is the Pug. The Pug is a small, compact breed with short legs, a barrel chest, and a wrinkled face. The ancestry of the Pug is unknown, although it is believed to be one of the first breeds miniaturized in Asia. The American Kennel Club recognized the breed in 1885, and since then it has become a popular show dog. Pugs have short, fine coats colored in fawn and black with distinctive black markings on its muzzle, ears, cheeks, and forehead. Coat care is minimal, requiring only an occasional brushing. But regular cleaning is a necessity, especially for the wrinkled areas around the face, in order to prevent skin infections such as skin fold dermatitis. Pugs are prone to some major health problems such as pug dog encephalitis and canine hip dysplasia. Pugs usually weigh between 14 and 18 pounds with a tail that curls tightly over the hip. They're playful and friendly pets, strong-willed but not aggressive, and they interact well with children. They will often shadow their owners, following them wherever they go to stay close to the action. Pugs tend to be lazy and spend a lot of time napping, so be aware that pugs are prone to snoring and wheezing due to their short snout. Pugs have a lifespan of between 12 and 15 years.
From 15 to 30% of people with allergies also have allergic reactions to cats and dogs. And the cause of your sneezing and itchy eyes isn't what you may think it is. To find out more about ways to deal with pet allergies, I spoke with allergist and immunologist, Dr. Brandon Hill. Thank you for coming on the show today. So tell us a little bit about allergies to pets and what that entails.
Most patients who have underlying allergies, they may be allergic to trees, grasses, or ragweed. They also may have pet allergies, such as cats and dogs. It's actually very common for patients who have underlying allergies as well as asthma to also have underlying pet allergies.
Okay, and so when you have pet allergies, you're not actually allergic to your cat's fur, your dog's fur. What is it that you're allergic to?
Correct. Most patients think that it's actually the fur that you're allergic to or the hair. It's actually the dander, the skin, the saliva, and actually the urine that most patients are allergic to. So the cat allergy or the dog allergy is not related to the length of the hair. It's actually the dander or the skin.
Okay, so really, because my cat, like all cats, clean itself, I'm allergic to it because of the saliva on the hair. Correct.
It has nothing to do with the hair. It's actually the cat licking the fur and the fur shedding. It is actually the saliva that the patients are allergic to.
Okay, so there is no such thing in that case as a hypoallergenic pet?
No, there's no such thing as a hypoallergenic pet because it's not just the hair. Patients are allergic to all of the secretions from the animal.
So what are some of the basic things we can do if, let's say, I love Fluffy, but I don't want to give her up? What are some things I can do around the house?
There are actually three modes of treatment for patients who have underlying pet allergies. The first thing is environmental control measures. Now, most patients are not able to remove their pet from the home, but that would be the ideal situation. But if you can't remove the pet from the home, it's best not to allow the pet to come into your living environment. So I usually allow patients not to allow the pet into the bedroom. You can also do some environmental control measures in the bedroom, such as removing the carpet from the floor and putting down a hard surface. You may be able to use some of the allergen covers for the mattress, the pillows, and the box springs. You can also obtain some HEPA filters or air purifiers for the room. All of those things in combination will help patients who have underlying pet allergies.
Okay, and I know some people think that having a window open, having some fresh air come through the house kind of helps out, but that may not necessarily be the case?
That's not necessarily the case because usually most people are not just allergic to their pet. They may have multiple allergens. They may be allergic to trees, grasses, or ragweed. And when you lift the window up to the home, it's actually allowing those allergens to come in the home, and it may actually compound your pet allergy.
Okay, and let's say that the filters, the HEPA filters and all those things you mentioned don't really work. What's the next step they can take?
The next step is medications, and you can usually use antihistamines by mouth. There are also antihistamine nose sprays that are effective. Most patients will also get some benefit from nasal steroids. These are medicines that must be used on a daily basis to better control your symptoms. In patients who do not respond well to medicines, there's also immunotherapy or allergy injections. This is actually a regimen in which patients are receiving the thing that they're actually allergic to, and we're desensitizing patients to their allergies.
Okay, and how long does that process take?
It usually takes 5 years. It's a course of allergy injections where you initially start weekly and it's gradually spaced out from there, but the time course is 5 years for the treatment.
Okay, so that is somewhat of a commitment there.
It's a commitment, but most patients do get a good response from it.
Okay, so you don't necessarily have to get rid of Fluffy. There are other things that you can do.
There are other things that you can do to better control your symptoms, to allow you to live with your pet. There are environmental control measures, medications, and allergy injections.
Okay, and what about keeping some of the blankets and other things like that in the home clean? Does that help at all?
It does help. It also helps if you can have leather furniture so that the allergen doesn't actually settle into the furniture. So you can do leather furniture, make sure you're vacuuming on a weekly basis. All of those things are helpful.
So what is the advantage of an indoor versus an outdoor pet?
There really isn't much advantage between having an indoor versus an outdoor pet, particularly in patients who have multiple allergens, because oftentimes if you have an indoor-outdoor pet, the pet may actually be bringing in tree, grass, or ragweed allergen into the home and actually making the pet allergy worse.
Okay, and earlier you had also mentioned that if you're going to have contact with your pets, that you should try to keep your hands clean afterwards.
Definitely. It's always helpful not to try to If you can, not try to rub on the pet or kiss the pet or play with the pet too often. But if you must, then it's helpful to wash your hands after you finish.
And what are some of the symptoms that will show if you are allergic to your pet?
Oftentimes patients will present with runny nose, stopped up nose, sneezing. Patients often have itchy or watery eyes. Some patients actually will develop itchy skin or will develop hives. In the worst case scenario, particularly in patients who have a cat allergy, it's not uncommon for them to develop asthmatic symptoms where they may develop shortness of breath, coughing, or wheezing. And in those patients, you may have to use daily inhaled steroids to better control their symptoms.
Okay, so definitely nothing to joke about.
No.
Well, again, we thank you for coming on the show, and hopefully this information will help other pet owners who have allergies.
Thanks for having me.
If you're looking for a pet that's a bit more exotic than your average dog or cat, maybe you should consider reptiles. Recently, Andy Williams from Lichterman Nature Center paid us a visit and brought along one of the most popular reptile pets, the blue-tongued skink.
Thank you for coming back on the show again, Andy. Tell us about what you brought today.
Well, Natalie, today I've brought a blue-tongued skink. This lizard is from Australia, although we have skinks here in the United States. The ones in Australia and New Guinea, the South Pacific, are a lot larger than native skinks. But, they got the same reptile characteristics. They have a long body, they have scales that are interconnected. One difference between lizards and snake is that lizards have eyelids that they can blink, and they also have external ear openings, which you can see here on the side of the blue-tongued skink. They make excellent pets. Skinks are noted for their thick, stout body and short, stubby legs. They move around during the daytime primarily. They sleep at night in hiding places. One of the really cool things about them is that they are omnivorous. By omnivorous, they eat both plant and animal matter. The fact that they eat a fair amount of vegetable matter is a little unique among reptiles. It really makes them easier to take care of as pets.
Okay, and back to what you were talking about with the difference in it and the snake. It kind of looks like a snake with legs, so what are some other differences?
Well, it does look like a snake with legs, but there are certainly important anatomical differences. Also, the jaws are fundamentally different, and again, the external ear openings are remarkable. That it sets them apart, but they all part of the reptile kingdom. And if snakes freak you out, probably the the skinks will have some of those same characteristics. Snakes are also kept frequently as pets, and their requirements are similar but different. Snakes maybe don't give back, they interact with their owner as much, but their housing requirements are a little simpler. In the case, if you want to keep a reptile, particularly a lizard, particularly a skink, you'll need to make sure you have an appropriately large enclosure. As you can see, this lizard is almost 2 feet long, and it lives in a large habitat that's, the one we have at work is roughly double the size of a 55-gallon aquarium, which would be the smallest you'd keep an adult skink in your home. When designing a habitat, you can see these lay low to the ground, and so you need to have a certain amount of square footage at the bottom. They're more interested in wandering around than they are climbing and such. Snakes basically need a hide box, a water dish, and a warmer area of their cage to retire to. The skinks need all of that, but in addition, they need full spectrum lighting. There's special light bulbs that you have that have what they call UVA and UVB lighting. That's very important for the metabolism.
Okay, so would this be a good reptile to start out with as your first pet?
Yeah, if you've done your homework and you think a reptile is a good pet for you, they're an excellent starter lizard to keep. They're docile. Whether they interact with someone is a matter of interpretation, but they do tend to recognize people that feed you. They're very evocative. If they're hungry, they let you know. They're even-tempered, slow-moving in this case. I've got my hand out as a precaution, but it'd almost take a stick of dynamite to get this one charging across the room. Not that he couldn't if he wanted to.
And so what are a few things that you would need to take into consideration as far as maintenance goes?
Well, as far as maintenance, the first thing, are you a reptile person? In particular, are you a lizard? Do you have the capability to provide the initial setup? Also, you've got to keep in mind, how long do I want a pet for? If it's for the children, that's not necessarily a good choice unless you want your children to live at home 20 or more years. They're very long-lived, but they have basic requirements, they interact to an extent, and they're fairly easy to feed.
Okay, well, thank you for bringing him along and telling us all about him.
Well, thanks for having me.
That's all for this edition of Your Family Pet.
We'll be back in June with more stories about the animals that we love.
So tune in next month for more of Your Family Pet.
Production funding for Your Family Pet is made possible in part by Memphis Veterinary Specialists, a referral-based specialty hospital serving the needs of small animals, offering diagnostic tools and treatment options not typically found outside veterinary teaching hospitals, including orthopedic and neurologic surgery, oncology, dermatology, dentistry, ophthalmology, internal medicine, and more. And by viewers like you. Thank you.